Hi, I'm Kayla and I'm 26 years old and I had breast reconstruction with the Natrelle INSPIRA Cohesive. My favorite things to do are spend a lot of time with our family. I have 2 boys. We go hiking, camping, biking, anything outside. I like sharing my story. I'm pretty open about my reconstruction and my surgeries that I've had, and I just like sharing the story and letting other people know that they can have surgery. My mom's doctor had suggested I start my mammograms at age 21 because my mom had breast cancer. My aunt had it 2 times. The first time she had it was at 27, and then my grandma had it also. So I had asked my doctor about if he thought I should start the mammograms, and he recommended doing the testing because if I wasn't BRCA positive, there was no need to start doing mammograms at such a young age. So he did the testing. It came back positive. He kind of went over my options a little bit with me, but he sent me to a breast surgeon to talk with her so she could give me the options between high-risk screening, doing nothing, and doing the double mastectomy, the preventative one. So I talked with her for a little bit, and my husband and I decided together that the mastectomy was the best option for me. When I first met with the plastic surgeon, we obviously discussed like where you start and what the first surgery is like, and then we discussed the 3 months of having my tissue expanders in there. They went over that a lot with me, I think to give me like a heads up on what it would be like, and so I had realistic expectations. And then we discussed the reconstruction and how it worked to exchange the expanders to the implants, and then we talked a little bit about if I needed the fat grafting in the future, where we would be. So I did end up needing the fat grafting. I had a little bit of rippling from my implants, and so we ended up doing the fat grafting. We transferred it from my thighs to my chest to kind of fill it out and make it a little bit more smoother. My surgeon and I talked a lot about the implants and the options that were out there, and we settled on the Natrelle INSPIRA Cohesive because I wanted to look like me. I didn't want the surgery to be a big change. I just wanted to have my new implants and just keep moving forward. When I felt the Natrelle INSPIRA implants, they were very soft. That was something that I was looking for, and he cut one open so that you could see what it looks like on the inside, and it was kind of cool. I love my results. I've told a few people that I meet that I've had a double mastectomy with reconstruction, and so I just love that it's looks like me still. The piece of advice that I would give anybody that's tested BRCA positive is just to really consider your options. Ask other people their stories and ask for what they went through and what their options were, and just really reach out and try to get as much support as you can, because it's a tough thing to go through.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants. Although rates are not well defined, some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue, tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, example lupus and scleroderma, a weakened immune system, example taking medications to decrease the body's immune response, planned chemotherapy or radiation therapy following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to breast tissue, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.